The reason it is done, there are many reasons why that happens. People feel that if they do that, then they will preserve the virginity. They will prevent promiscuity of women. It is also seen in some cultures as a practice of passing a girl to a womanhood, from a girl to a womanhood. It is a ritual.
Like an initiation.
Initiation. In some way, it is also seen as a way to make sure the clitoris doesn't grow too big, because they believe that if it touches the head of the baby during delivery, that baby is going to die. So there are many, many reasons why the practice has been done in different communities. Basically, that is what we call female genital mutilation.
But it appears Africa is taking the lead in this practice.
It is practiced not just in Africa, it is also in Asia and other parts of the world. It is practiced, and we even see it now, even in Europe and America, by migrants from these communities. So it is not African limited practice. It is a practice that is beyond Africa, which has taken generations. It is seen in different communities across the globe.
Okay, we are going to look at some piece of legislation and policies, on how that goal set by what leaders can be achieved. But as a medical doctor, we'd like you to, enlighten our viewers on the medical implication, hazard of, a man surrendering his girl for mutilation, genital mutilation.
First of all, when a woman undergoes female genital mutilation or cutting, the immediate impact could be bleeding, because she's being cut. And in some accident have happened so that the woman bleed to death. An infection can also occur because the skin is open, and the woman can get the infection that can even cause her death. Apart from that, cutting the woman in some cases has even led to a fistula, because the cutting can open up into the bladder and cause leakage. Apart from that, in some cases of FGM, where the extreme cases of FGM, where they actually cut it up and suture it back to close. When the girl reaches the age of menstruation, she starts finding difficulty because the blood can't come out because it is completely closed. And she may be having pains every month because the blood remains in there, it's not coming out. And if ever she gets pregnant, then delivery is a problem. It will need to be opened up before she can deliver. That opening up is another process that can lead to bleeding and her death. So there are many, many medical complications that result from this type of practice. Just to mention a few, it can also lead to infertility because of the complications that result from this type of practice.
Infertility is an issue in our clients. And for a victim of FGM, is there anything they can do to, check whether or not in the process of that cutting, it may have affected their state of being fertile when, of course, they get married?
Certainly, there are protocols that UNFPA has supported the Federal Ministry of Health to develop the national protocols on the clinical management of FGM. And some of these address the issues on how to take care of a woman who has undergone female genital mutilation. What are health care providers supposed to do during the time that she is not pregnant, when she is pregnant, when she is about to give birth? What are the things that need to be done as medical care? And one of them is to look into all those issues. What are the complications that have resulted from FGM?
It is also said that FGM is a violation of the right of women and girls. what makes it violation? When the dad or the parents, willingly give out their daughters, to be initiated into womanhood through courting. At that point, they make choice for them. So what makes it an abuse of the right of course?
Female genital mutilation is child abuse. The fact that you give birth to a child doesn't mean that you have complete right and you can do anything to that child. You subject the child to torture, to inhuman treatment, to health problems by doing FGM. And so, in that line, it is a human right. It is a fundamental human right violation because people have the right to have, they have the right to good mental health, they have the right to determine the number of children that they want to have. They have all those rights, but subjecting somebody to FGM means that she may not even enjoy her sexual well-being because sometimes she'll be feeling pain throughout, and she may not be able to get pregnant. She may even bleed to death. So it is a violation, complete violation of human rights.
So if you are to suggest to the Nigerian government, what kind of policies or legislation should be put in place to address this?
Yes, I think the government has been doing some work a lot of work in this area since 2015 when the campaign started. The Violence Against People Prohibition Act, which was actually enacted in 2015, is one of the laws that prohibit FGM in Nigeria. The government has also supported the launch of the campaign, which was actually led by the wife of the president in 2016. And the campaign has led to the mobilization of wives of governors to rally around this as champions to really fight against female genital mutilation. The government has also looked at it from the medical perspective. What type of care, what are the protocols needed to train healthcare providers in this area to be able to take care of this. And even gone, we supported working with the government and the civil society. We work in the communities to engage gatekeepers to actually start changing these social norms, because it's actually social norms behind this. And in fact, since the campaign started, over 1,300 communities have declared abandonment of FGM in Nigeria. So the challenge is that we have the legislature. First, need to be domesticated at the state level. Not all states have domesticated this prohibition of FGM in their state. And secondly, even where the law exists, there is still a problem with reinforcement of those laws. So those are areas that we're facing challenges.
It appears UNFPA, UNICEF, those world bodies in charge of this or responsible for enlightening Nigerians to abandon this practice is doing very little. What does it take for the UN body to criminalize countries that are still neck deep into this practice?
Well, the UN is made of member states, and the member states are those countries we're talking about. Okay, so it's not all that easy for UN to criminalize an autonomous state. States are autonomous in what they decide, and the UN is there to support those states to realize their priorities. So UN, unless it is an international criminal court, the UN doesn't have the right to decide what type of laws are in each state and how to go about it. The states are autonomous in that area.
Okay, for those that have fell victim, you talked about the fact that there's a plan to help those that are already victims. But you see, it goes beyond the medical, the physical, the psychological, the social. What becomes of them? How can they be helped?
Well, the impact of FGM in different women, the impact varies from woman to woman, and also depends on the extent to which the FGM was done, because it is not all the same. FGM is classified from class type 1 to 4, depending on the degree to which it is done. Some cases are minor and some really are really serious. And it also depends on the psychological mindset of the woman. There are many factors that come into play. But in general, women who have gone through it do complain of real psychological trauma. We do find physical medical issues, like issues I've talked about, problems with deliveries and all that. So the approach is that to look at each woman who has FGM as an individual entity and tailor the treatment to the woman based on the needs that the woman has. Not all women will have the same level. Some will actually need mental health care because they're really traumatized. Some will just need some counseling, and some may not have problems in delivery if it's a minor case of FGM. So there are different types of, depending on the extent to which the cutting was done.
I also like you to also throw light on this as a medical doctor, because those who are still doing it, they believe that when it is done, the woman may not have tendency of promiscuity. I have a friend, you won't believe it, is a copper, and the wife was pregnant. He said to me that she has to go and be initiated into womanhood. And I asked, what do you mean? He said, no, she has to be caught. A pregnant woman has to be caught to be part of womanhood. Now, as a medical doctor, is there any relationship between cutting and having satisfaction sexually? Is there any relationship between cutting and promiscuity?
Well, from the medical point of view, what I will say is that the clitoris is a very sensitive part. And depending on the cutting, if you remove the clitoris completely, it means that you are actually depriving the woman of any sexual well-being. And probably that is because you won't have any sensation at all. You have actually removed that part which is essential for her. So in some cases the clitoris is not removed, it is just cutting or piercing or done. So depending on the type, it may affect the woman well-being or not, sexual well-being or not.
Is there any form of repair that can be done to those that are badly cut?
Yes, certainly. Those that are badly cut, like what we call infubulation, which is the actual cutting of the external genitalia and suturing back to close completely the vagina. In that type of case, there is a way of reopening it, and that is done during delivery. The challenge we are seeing is that even the healthcare providers are becoming part of this practice, where people feel that if it is done by a doctor, then it is safe. And they are taking their children to the doctors to do it because they feel it is done. So we do work with the medical associations and professional associations to actually, and many of the associations have actually declared that any of their members is not a practice authorized by the association or the professional bodies. They have done it and they have written it down, and many are now fighting it, trying to see which of their members is responsible for this type of practice. But I will tell you that there is a certain percentage of women who have undergone FGM by a doctor or a nurse or a midwife.
It's interesting. But for those that are ardent believer of culture and tradition, what can be done to, disabuse their mind?
Well, what I told you earlier is working with the gatekeepers first of all, because those are the people that the people believe. The traditional and religious leaders, the people trust them. And we have been working with these gatekeepers. Those who are convinced that this is not a good practice, they talk to their community and try to convince them. And we have been seeing results. The evidence is that more than 1,300 communities in Nigeria since then have declared abandonment, that they are not going to practice FGM anymore, and that they don't want any member of their community to do it anymore.
Okay, if you are just joining us, the program is Health is Wealth, and we'll be looking at the effect of female genital mutilation. The discussion has been with the acting representative, United Nations Population Fund, Nigeria, Dr. Eugene. Okay, as we're about